So guys, myself Akash. So we are going to see general physical examination. Okay, most basic thing, which is the also like mnemonic you already know. Pickle, PICCLE, pallor, icterus, cynosis, clubbing, edema, lymphadenopathy. Pallor, icterus, cynosis, clubbing, edema, lymphadenopathy. Okay, repeat it 5 times and take a screenshot of it. Now I'm just coming to the first is pallor. Okay, we will go with chronological order. Pallor, icterus, cynosis, clubbing, edema, lymphadenopathy. Pallor is most common causes of pallor are anemia, leukemia, heart disease, sleep deprivation, and shock. Anemia, leukemia, heart disease, sleep deprivation, shock. Okay, causes of pallor. So most commonly is anemia. They will ask like 3 marks question. What are the types of anemia? There is normocytic normochromic, macrocytic normochromic, and microcytic hypochromic. Okay, read all these types and the 3 marks important question. Next, where you will see pallor, you can see here lower palpebral conjunctiva, and it is on the tongue. Here, the one which is we need to see is this one. Okay, see this box. Okay, ideal pallor, ideal case of pallor. Okay, next going to the pallor icterus. Okay, icterus is a deposition of bilirubin pigments. Therefore, it is a yellowish discoloration of the sclera, and also on the skin you can see. Common causes of icterus are pancreatitis, cholecystitis, cholelithiasis. Okay, pancreatitis, cholecystitis, cholelithiasis. So icterus means nothing but jaundice only. It is divided into 3 types: prehepatic, hepatic, posthepatic. Prehepatic is also known as hemolytic jaundice. It is caused due to hemolysis, increased hemolysis of the RBC. Hepatic jaundice because of some pathological in the liver. Next is posthepatic, means after the liver. That is because of obstruction. Okay, obstructive jaundice. It is also an obstructive jaundice. Next coming, this is a classical case of icterus. Okay, you can see yellowish discoloration of the sclera. Why it is happening? It is because the elastin fibers which are present are holding up of they hold up more bilirubin. Next coming to the pallor icterus cynosis. Cynosis is bluish discoloration of the peripheral. It can be 2 types: central cynosis and peripheral cynosis. Okay, cause of central cynosis. Decrease arterial oxygen saturation, means decrease in oxygen saturation, in a high altitude, impaired pulmonary function, alveolar hypoventilation. Okay, there is what totally there is decrease in oxygen saturation. Another one is anatomical shunts. Okay, arteriovenous shunts, that is anatomical shunts. Certain types of congenital heart diseases and pulmonary arteriovenous fistula, multiple small interpulmonary shunts. Next is hemoglobin abnormalities like methemoglobinuria, methemoglobinemia. Okay, sulfa hemoglobinemia, carboxyhemoglobinemia. Okay. Next is peripheral cyanosis. It occurs in peripheral organs like digits. Okay, your digits, fingers. Peripheral cyanosis because of reduced cardiac output, decrease in cardiac output, cold exposure, redistribution of blood flow from extremities, arterial obstruction, venous obstruction. Okay, remember the causes of central cyanosis and peripheral cyanosis. You can see the one which you are seeing on your left hand side is cyanosis. Okay, this is bluish discoloration, and the right hand is normal. This side is normal. Okay, you can see this. Okay, this is cyanosis. Don't confuse it with clubbing. Okay, when you will see this bluish in color, this will be cyanosis. Okay, next coming to the clubbing. Okay, what are the causes of clubbing? Cardiac causes, respiratory causes, GI causes, miscellaneous causes. Okay, there is also a mnemonic of clubbing. It is clubbing itself. I will show. Cardiac causes: infective endocarditis, cyanotic heart disease, arterial myxoma, aneurysms, and infected grafts. Next is respiratory. Respiratory most common is COPD. Okay, COPD, bronchiectasis, emphysema, abscess, cystic fibrosis. Okay, causes of clubbing. Next is GI causes: inflammatory bowel disease, IBD, malabsorption, cirrhosis, and GI lymphoma. Okay, miscellaneous is thyrotoxicosis, Graves' disease. These are common things. Causes of clubbing. You can see stages of clubbing. Okay, 1, 2, 3, and 4. Stage 1 is normal appearance and angle but increase in fluctuation of the nail bed. Stage 2 is loss of angle between nail and the nail bed. Stage 3, increased curvature of the nail. Stage 4, expansion of the terminal phalanx, drumstick appearance. Okay, remember this: drumstick appearance and fluctuation in the nail bed. Okay, these two are important words you should tell. Okay, there are 4 stages. So I said a mnemonic for clubbing. It's the clubbing itself. Okay, C for cyanotic heart disease and cystic fibrosis, L for lung cancer and lung abscess, U for ulcerative colitis, B for bronchiectasis, B for benign mesothelioma, I for infective endocarditis, N for neurogenic tumor, G for GI disease. Okay, take a screenshot so you can remember it. Okay, but try to remember according to system wise. It will be more helpful to you. Now coming to the edema. Okay, you know edema. Deposition of fluid in the extracellular space. It can be unilateral leg edema or bilateral leg edema, and it can be acute and it can be chronic also. Acute means it is in a short duration of time, and chronic means it took more time to happen. Okay. The causes of edema. Edema is in like generalized edema or localized edema also. So based on that, there are different etiologies. Okay. There are 5 factors which contribute to the formation of edema. The one is increased hydrostatic pressure, reduced oncotic pressure within blood vessels, increased blood wall permeability as in inflammation, obstruction of fluid clearance via lymphatic system, changes in water retaining properties of the tissues. Okay, let me explain you. Okay. So imagine blood is coming from this side, like any fluid is coming from this side and going from this side. Okay. If one there is increased pressure here. Okay, and therefore more fluid is coming, and therefore it exudates out. One cause. Next, there is increase in the permeability of this capillary wall. Okay, increase in permeability. That's why there is leakage of fluid out. Okay. Second, and third, there is obstruction here. Okay, obstruction here. So what will happen? The fluid will accumulate here, so no space to go, it will leak out. Okay, these are the major 3 causes which causes edema. Next is a retaining property, water retaining. You know protein called albumin, 6 to 8 milligram per deciliter. When there is common protein, when there is decrease in the albumin concentration, the water cannot hold, and change in oncotic pressure leads to the exudation of fluid to the extracellular space. Okay. Next, causes of edema, systemic and localized. Systemic are allergic reaction, cardiac disease, hepatic disease, malnutrition. You go through these causes. Okay. Edema can be pithing edema and non-pithing edema. Non-pithing edema examples are mixed edema, elephantiasis, and angioneurotic. Okay, most common is mixed edema and elephantiasis. Remember, non-pithing edema, mixed edema, and elephantiasis. They will ask this more and more. Next is pithing edema is seen in cardiac causes, renal, liver diseases, early stages of filariasis, and calcium channel blockers. Okay, pithing type of edema. Liver diseases like cirrhosis of the liver. Renal is CKD. Cardiac is congestive heart disease. Okay. You can see this is a pithing type of edema. So I will upload a shot. Okay, you can see that shot also. I have demonstrated a pithing edema in a CKD patient. Okay, so grading of edema is that is a +1, +2, +3, and +4. +1 is only 2 mm depression, barely detectable, immediate rebound. Okay, once you remove your finger, there is a immediate rebound. Next is 4 mm deep pit, a few seconds to rebound. 6 mm deep pit, 10 to 12 seconds to rebound. 8 mm very deep pit, greater than 20 seconds to rebound. Okay, so they have divided it based upon the depth of the edema, depth of the pit, and time to recover that pit. Okay. Next, coming to the lymphadenopathy. Okay, pallor, icterus, cynosis, clubbing, edema, lymphadenopathy. Lymphadenopathy is last. Okay, what is lymphadenopathy? The enlargement of the lymph nodes. It can be localized or regional lymphadenopathy or generalized lymphadenopathy. Okay. Causes for localized lymphadenopathy are infections involving skin and maxillary genitourinary lymphogranuloma vulnum caused by chlamydia trachomatis. Next is cat scratch disease. Third is primary hematological malignancy like Hodgkin's lymphoma. Next is other malignancy metastasizing to the lymph nodes. Okay, by local or distant spread. Most common cause for this for breast cancer. Okay, it goes to the axillary group of lymph nodes. Okay. Next is generalized lymphadenopathy. Infection cause viral infection like Epstein-Barr virus, cytomegalovirus, human immunodeficiency virus, rubella. For bacterial causes, it is tuberculosis and syphilis. Protozoal, it is toxoplasmosis and leishmaniasis. Okay. These are whole microbiology only. Next is the lymphoproliferative and myeloproliferative disorders. Autoimmune like systemic lupus erythematosus, that is SLE, rheumatoid arthritis, and Sjögren's syndrome. Dermatopathic by eczema and psoriasis. Drugs are allopurinol, carbamazepine, phenytoin, penicillins, atenolol, captopril, and isoniazid. Okay, so causes of lymphadenopathy. This is the most important picture. Go through this video again and again. Pause this and read this. Okay, this is a cervical lymphadenopathy. Okay, lymphadenopathy demonstration video is also there. So watch the demonstration video also. So thank you guys. This video is for education purpose only. So starting only I will show you the demonstration itself. Pictures are taken from Google and few websites. I hope no copyright strike comes to this video. I don't hold any copyright claim on these pictures. Okay, only one video that is shooted by me. For any copyright issues, please contact at AJJ12345. Thank you for watching. Share in your batches. Jai Hind, Jai Bharat. Bye bye. Love you all.